Well, it's World Diabetes Day, and endocrinologists are calling on the Nigerian government to exempt import tariff on insulin and other drugs for the management of diabetes. They say it will allow more patients to have access to affordable care for the chronic disease. TVC News' Vivian Irikefe reports.
For more than 20 years, Sam has been taking insulin medication. It's a hormone that regulates blood sugar. Sam will depend on the insulin for the rest of his life because he is diabetic. Sadly, not everyone who needs the treatment can afford it.
When the frequent urination started, I just walked to the doctor's clinic and they checked and they said, yeah, I was diabetic, and since then I've been controlling it. I'm actually on insulin and some other oral medication. The main challenge for Nigerians living with diabetes is the fact that they cannot control the condition because the drugs are expensive and the test kits, you have to, for you to be able to control diabetes, you should check your blood sugar on a daily basis. Many cannot do that because the strips are quite expensive.
The cost is quite enormous. Most patients in Nigeria pay out of pocket because we don't have strong health insurance. And how do we expect the economy to grow if the population that are meant to grow the economy are down with this disease?
Restrictive diet has always been an issue in the management of diabetes, but this endocrinologist says it's irrelevant.
There is no special food for diabetic patients. The diabetic patient is managed with the food that is present locally and culturally acceptable to the patient. What is important is the quantity of what the patient takes, not the food itself. It is not caused by the food you eat. It is the problem with insulin and insulin not working well.
The chronic disease is more troubling for women of reproductive age, especially where there is lack of affordable access to care.
A lot of women out there have diabetes they don't even know, and most of them are pregnant and they have diabetes and they don't have access to care. And what do you want at the end of a pregnancy? You want a live mother and a live baby, and that is why attention is on them so that we can actually look out for these people and make sure that they have access to care so that they can be healthy.
Adults with diabetes are predisposed to heart attack and stroke. The signs and symptoms include frequent urination, unexpected weight loss, and poor vision. Vivian Irikefe, TVC News.
And still to come on TVC News Hour, we will have in the studio with us to discuss World Diabetes Day. And he will be the person of the National Coordinator for Stop Diabetes Awareness Foundation, Dr. Adetola Soyingbe. That's after the break. To stay with us. Glad to have you back. You're watching TVC News Hour. Well, this year's theme for diabetes is Women and Diabetes. There are currently more than 199 million women living with the disease, and this total is projected to increase to 313 million by 2040. That's whopping. With me in the studio to shed more light on this is the National Coordinator for Stop Diabetes Awareness Foundation, Dr. Adetola Soyingbe.
Good evening, madam.
Thank you for being here.
Thank you very much.
Now, this year's theme is Women and Diabetes. How more susceptible are women to diabetes as opposed to men?
Okay, thank you very much. In recent past, it used to be almost similar in terms of the ratio of men and women. But in recent times, we noticed that women are beginning to, increase in number more than men. And what we noticed is three main factors. It is noticed that more women these days are more obese than men. Obesity, which means their body mass index is greater than 30. Also, because of hormonal factors, women tend to, during childbirth, a lot of them are prone to something, not all of them, there's a percentage that's prone to what we call gestational diabetes. So that also, even after childbirth, the risk of having diabetes is there. And in recent times, we notice that our women are becoming more religious.
What happens? Why do they get this gestational diabetes?
Okay, what usually happens is, you know, during pregnancy, they had weight, that's obesity, and you have to understand that that is a major risk factor for diabetes itself. And it can also lead to what we call tissue resistance.
But these poor women are simply trying to feed the unborn baby properly.
Exactly. It's a sad one, but the most important thing for us is we need to make sure that early detection is key. If you can detect early and they get adequate treatment, they won't have to eventually have diabetes. Really.
And how do we detect early?
Early. Now, it is very important that we have, first of all, adequate healthcare institutions that can attend to pregnant women. We have to have skilled workers who can attend to skilled healthcare. Most importantly, antenatal services. You know, they need to check women's blood sugar, and also they check their urine and notice if there's anything irregular. That way, we can, you know, we can attack it from the source.
Shouldn't that be like standard procedure for all people who come to the hospital?
Yeah, actually it's standard procedure, but you have to understand that there are certain areas, rural areas, where they are not at par with what is happening in the urban area. So it happens once in a while.
All right, the number of women living with the disease is projected to increase to 313 million by 2040. How do we ensure that this number, we don't reach this number?
Most importantly, like I said, during antenatal, our women need to be screened properly. Now, when they screen, those who are at risk, those who are already obese even before pregnancy, and those who actually have it at that time, when it's detected, they start their medications on time. Also, we know I need to make sure that their diet is at par to actually prevent them from having diabetes after childbirth. So if you can do this, the appropriate intervention and also government collaboration with advocacy bodies, I think with this we should be able to avert that.
In the last report we watched, my colleague talked about insulin and why it wasn't working well. Explain that to us.
Okay. In layman's terms, let me just explain this. Diabetes basically means that the inability of the body to, you know, to actually handle energy it gets from food. Now, when we eat, say we eat carbohydrate, for example, it's broken down into glucose. So what insulin does is that it drives the glucose into the cells for the body to use the glucose. But in a situation whereby insulin, which is an hormone that is produced in the pancreas.
Insulin is a hormone.
Exactly, it is a hormone. It is a hormone.
Okay.
So if it's not enough to drive the cells, drive glucose into the cells, and it accumulates in the body, it can damage tiny vessels. So basically that's it. So it's actually about insulin, not actually the food we eat.
Okay. How affordable are all these medications to treat and manage diabetes?
Well, I think in recent times, compared to about 10 years ago, it's becoming more readily, more cost-effective and more readily available. Of course, it also depends on the purchasing power.
When you say cost-effective, what are you actually saying?
Yeah. It also depends on, what I'm trying to say, it also depends on the purchasing power of that
the individual.
The individual.
Okay.
A drug that goes for about 5,000, 10,000 naira a month, someone who is earning 300,000 naira will not really feel the impact. You can imagine someone who is earning 15,000 naira needs to pay 10,000 naira. So I think the most important thing is these medications should be made cost-effective for our patients who have diabetes. Hopefully, that way they can have adequate compliance. Compliance means they're taking their drugs regularly.
And at the right time.
At the right time, yes.
Dr. Adetola Soyingbe,
yes, ma'am.
National Coordinator, Stop Diabetes Awareness Foundation. Thank you for being here.
Thank you very much, ma'am.